Hey everyone, welcome to my YouTube channel. In this video, I'm going to be talking about the classes of respiratory herbs. It's well beyond time that I address this. I really want to help you manage your respiratory symptoms at home during this time. It's April 1st, 2020. It's starting to get really intense with COVID-19, at least here in the States. And so I want to give you guys some insight on how to manage whatever symptoms you're dealing with at home. We can turn to so many herbs for that kind of home management. Lots of tools and resources at our fingertips from the plant medicine world. So today you're going to learn just the different classes of respiratory herbs so that you walk away with a little bit more insight on managing your symptoms at home. My name is Stephanie Tanner. I'm a registered nurse, an herbalist, and a doula. I've been a community health worker for 13 years. If you like this video, make sure you subscribe so you don't miss out on any more health and wellness tips from your favorite holistic nurse. Let's get into it. All right, friends, we're going to dive right in and cover the actions of respiratory herbs. I split these up into a couple of groups because when there is a cough or mucus or any kind of upper or lower respiratory issue, they're not all the same, right? So we have to really think about what's going on in the body before we decide which actions we want to take. So when it comes to a cough, it can come up as several different things. It can be a really highly productive cough that has a lot of mucus, a lot of things to get out of the system. It can be a really dry, hacking, irritable cough, or it can be, just like a heaviness in the chest, the feeling that you have things to get up out of the chest or the lungs, or stuff stuck in the sinuses, but nothing is really productive. So we want to think about, like I said, what's going on first. So that's why I have organized the following actions into basically 3 different categories that help me kind of mentally recall exactly what our purpose is and what our goals are with each of the actions. So your suppressive actions are going to be just that. They're going to be calming down more irritable tissue states. Productive actions are going to actually really try to stimulate instead of calm things down. And then supportive actions are going to be more of your adjunct therapies that aren't necessarily specific to respiratory illness, but they are going to help the healing process along. What's really nice about herbalism is that many plants cross over into both territories. They have multiple actions. So what you'll find is that many of the herbs that fall into respiratory actions specifically also have many of the supportive actions as well. The first suppressive actions of herbs that we're going to cover are antitussives. These are your most common respiratory herbs. Most of them have an action that helps specifically relieve or suppress coughing. This might sound familiar to you. This is why Robitussin has its name, because it is an antitussive, one of the most common over-the-counter antitussives. So these herbs are going to be for those really irritable, keep you up at night, can't get through a sentence talking kind of coughs. The ones that just seem to be very spasmic and hard to control in nature. Now, these kinds of coughs, of course, can be either really dry and irritable or just really heavy and hacking and you're getting a lot of stuff up. So antitussives can be used in both ways. Now, antitussives can also have antispasmodic properties. So when we look at antitussives, they can have different actions. Their mechanism of action can be varied. So they can work either on the nervous system or they can work on the musculoskeletal system. But when we move on to antispasmodics, we're looking certainly specifically at the actions of herbs that can have an effect on muscles. So sometimes coughs are really irritable because they get into kind of a spasmic rhythm through the diaphragm. And so antispasmodic herbs can be extremely helpful, and especially when they are also calming and soothing to the muscles, and provide a lot of relief there. Anti-asthmatic herbs are herbs that specifically are known to relieve signs and symptoms of asthma, and that can include anti-inflammatory herbs, antihistamines, and of course stimulating herbs in much similar ways to the stimulating medications that asthmatics are known to use to open up the alveoli and the bronchioles. Asthma is a very complicated disease process that has different mechanisms. And so the herbs that are used to address those can't be really categorized into one action, but I wanted to make sure that we knew here that they do exist and that there are herbs specific to relieving asthma. Anticatarrhals are specific herbs that eliminate mucus from the upper respiratory tract. If you've ever seen the abbreviation URI, that just stands for upper respiratory infection. It means anything from the airway up. So the throat, nasopharynx, that's all upper respiratory. And of course the sinuses. So an old term used in the old Materia Medica is catarrh, and that just means mucus. It means like really thick, nasty stuff that gets stuck in the sinuses when you have a sinus infection and such. So anticatarrhals address that directly. These herbs also tend to have multiple actions on the respiratory system in how they're able to eliminate that mucus, whether they thin it out or whether they're antimicrobial, which we'll talk about in just a few. Antihistamines are really important to mention as suppressive herbs because they suppress much of the inflammatory response that can lead to respiratory issues. If you have allergies, you know exactly what I'm talking about. Of course, that histamine inflammatory response can manifest as several different signs or symptoms, but since we're talking about the respiratory system, it's really important to mention here. There are really excellent herbs that fall into this category, and they're worth knowing and using along whenever there's that dry, raspy cough or that sneezing, post-nasal drip, that sort of thing. Now we're going to move on to our productive herbs, and these are all herbal actions that actually stimulate a response that you're wanting to take instead of really calming some of the actions that are already happening. Our first one is mucolytics. You might see some crossover or confusion between anticatarrhals and mucolytics. These herbs thin mucus. They make it less thick and sticky and easier to cough up. So not to be confused with something that actually suppresses the production of mucus. This takes that thick mucus and helps thin it out so that you can produce a cough, that your coughs are more productive that way. Mucolytics are often paired with expectorants, which allow the alveoli and bronchioles to actually get those secretions out of the lungs. So you're stimulating a cough with expectorants. These can be paired with antitussives, but they're commonly thought those two actions are not antagonistic of each other. They can be coupled together if you have a really dry, irritating cough, but you need to get stuff out. Expectorants can really help the lungs move things up and out, which is why it's really important to also thin that mucus out as well. And then, of course, we want herbs that offer a ton of support to our sweet, dear respiratory systems that provide us so much life and go through so much for us. They're very protective. We put a lot of pathogens and environmental toxins into our respiratory systems all the time, and it does really just such an elegant job of protecting our entire physiology. So let's support them. We turn to demulcents to provide a lot of moisture and mucilage to dry and irritated tissues. Many respiratory allies are also demulcents, but when we're trying to get that those secretions kind of dried up and moving along, we want to pair a demulcent as well, just to return moisture to those irritated tissues. Anti-inflammatory herbs are things that we can turn to as well. Our respiratory tract tends to be inflamed whenever there's an infection or disease process. So anti-inflammatory herbs come in lots of different forms. They have varied mechanisms of actions. So that's well beyond the scope of this video, but definitely keep them in mind when you're looking to support the respiratory system as a whole. And then, of course, if there's any kind of infectious process whatsoever, we need to consider something like an antimicrobial. This includes antibacterials, antifungals, anything that kills or inhibits the growth of any microorganism is antimicrobial and should be considered if you think you have any sort of infectious process. Not all respiratory signs or symptoms are connected to infectious processes, but antimicrobials are certainly not going to hurt your goals when you're working with herbs. And of course, in this video, I'm going to mention respiratory antivirals. These are herbs that kill or inhibit the proliferation of viruses. There are a couple really beautiful, wonderful, accessible herbs that are antiviral in nature, that are worth knowing, worth doing your research on, that also have really wonderful actions when we're looking at respiratory infections, common colds, that aren't bacterial, that are viral, that shouldn't be treated like a bacterial infection, but really should be paired with an antiviral herb that's also very soothing, brings moisture back to the area, and is antitussive, antispasmodic, very calming and suppressive as well. If you made it this far, thank you so much for watching. I really hope that this gave you some insight on the different classes of herbs, how we can really pay attention to our respiratory symptoms and respond to them in kind with the plants available to us. I would love to hear in the comments below what you found most helpful. If you have any more questions and how I can help you in future videos. If you're looking for deeper information, especially for specific herbs that fall into any of these categories or actions, make sure you click on the link in the description below. I have a plant medicine master list that is a paid product, but it gets you so much information and resources. It's $27. It just gets you into my entire materia medica, information on over 200 herbs, their actions, contraindications, indications, dosing, side effects, plus tons of research and resources. It's very, very rich and pretty much my brain dump in one single document. So I would love for you to check that out. And of course, make sure you're subscribed. I'll see you in the next video.